In this session, we will discuss the passenger labor, specifically the fetus, and we will be giving importance to the most common presenting part, which is the fetal head. Under the fetal head, we will discuss the different parts of the fetal skull, the suture lines, the fontanelle, and of course we will also discuss the different diameters of the fetal skull. Specifically, we have the longitudinal diameter and the transverse diameter of the fetal skull. So the fetal skull or the fetal head is the most important body part during labor and delivery because of several reasons. Number one of which, the fetal head or the skull is the largest part of the fetal body compared to the rest of the fetal parts. We also have other reasons such as the fetal head, if not always, it is the most common presenting part. And of course, the fetal head or the fetal skull is the least compressible of all parts because of the presence of the suture lines that allows the fetal skull to overlap, or that is what we call molding. So we have different parts of the fetal skull. We have the occipital bone, we have the parietal bone, and we have the frontal bone. So the occipital bone is located at the back of the fetal skull above the nape. We also have the parietal bones. So we have two parietal bones. We have the two parietal bones. We also have two frontal bones. We have the two frontal bones. Now we also have what we call suture lines that separates the fetal skull. So we have several suture lines. Number one of which, we have the frontal suture. So if we say the frontal suture, this is the space that divides the two frontal bone, or suture lines are the cranial joints. So the suture line that divides or connects the two frontal bone is what we call the frontal suture. We have also the sagittal suture. So the sagittal suture is the joint that connects the two parietal bone. We also have the lambdoidal suture. The lambdoidal suture is the joint that connects the two parietal bone and the occipital bone. We also have the coronal suture. So the coronal suture joins the two frontal bone and the two parietal bone. So as mentioned earlier, the suture lines facilitates overlapping of these cranial bones during labor, and of course when the fetus passes through the birth canal. So the suture lines will facilitate the overlapping. That is what we call the molding. And because of the overlapping of the cranial bones, the overall diameter of the fetal skull will be reduced. That allows easier delivery. We also have the fontanelle of the fetal skull. We have two fontanelles. We have the posterior fontanelle and the anterior fontanelle. So the fontanelle is a structure that is formed when two or more suture lines joints, or it is the area that is created by the joining or meeting of two or more suture lines. So let's discuss first the anterior fontanelle. Anterior fontanelle is also called as bregma, and the anterior fontanelle is created by the frontal suture, the coronal suture, and the sagittal suture. So the anterior fontanelle or the bregma is a kite shaped, and it closes approximately 18 weeks after delivery. The other fontanelle, is located at the back near the occiput, or in between the occiput and the two parietal bones. So the posterior fontanelle is also called as the lambda. So it is created by the lambdoidal suture and the sagittal suture. So the lambda closes earlier compared to the anterior fontanelle. So it closes around 6 weeks after delivery. So during labor and delivery, these two fontanelles plays a significant role also in identifying the fetal presentation, or to predict the presenting diameters of the fetal skull. So we have also regions of the fetal skull. We have the occiput. So the occiput is a bone between the foramen magnum and of course the posterior fontanelle. So we also have the sinciput or the brow. We have the sinciput. We also have the face, and of course we have the vertex. So the vertex is the area between the posterior fontanelle, posterior fontanelle, the two parietal bones, and in front is the anterior fontanelle. So the area between the posterior fontanelle, the anterior fontanelle, and the two parietal bones is what we call the vertex. So we also have the chin and the mentum, which is the landmark in identifying face presentation. So next one, we will discuss also the different diameters of the fetal skull. We have transverse diameters of the fetal skull and the longitudinal diameters of the fetal skull. Under the transverse diameters of the fetal skull, we have two transverse diameter. We have the biparietal diameter and we have the bitemporal diameter. So the biparietal diameter is the measurement between the two parietal bone, while the bitemporal diameter is the measurement between the two temporal bone or the temple. Next one, we also have the longitudinal diameters. So longitudinal diameter is the diameter from the back of the fetal skull going into the front or anterior portion, which is the face. So we have several longitudinal diameters of the fetal skull. So first, we will discuss the suboccipitobregmatic. So the first longitudinal diameter is what we call the suboccipitobregmatic. So the suboccipitobregmatic is the diameter below the occipital protuberance. If we say the occipital protuberance, it is the elevated area of the occipital bone to the center of the bregma. So the occipital protuberance from this area until this area is what we call the suboccipitobregmatic. So looking into the other model, so this is the occipital protuberance. So as you can see, the area that is protruding is what we call the occipital protuberance, and this one And the suboccipitobregmatic is measured from this point until the anterior fontanelle, which is approximately located here. So the suboccipitobregmatic is the presenting diameter when the fetal chin is touching the chest. Okay, so in this position is what we call a vertex presentation. So in the chin is touching the chest and the fetus is well flexed, and the presenting diameter would be the suboccipitobregmatic, the suboccipitobregmatic, or what we call the SOB. So the measurement from the occipital protuberance until the occiput is approximately 9.5 centimeters. So we also have the occipitofrontal. So the occipitofrontal is measured from the occipital protuberance going into the glabella. So the glabella is the area wherein the two eyebrow meet, or is located at the center of the two eyebrow. So the occipitofrontal diameter is measured from the occipital protuberance until the glabella. So at this point. So next one, we have also what we call the suboccipitofrontal. So the suboccipitofrontal is measured below the occipital protuberance. The two longitudinal diameter is measured at the point of the occipital protuberance, whereas the suboccipitofrontal is measured below. It is measured below the occipital protuberance, going into the center of the frontal suture. Center of the frontal suture. So the two, which is the suboccipitobregmatic and the occipitofrontal, is measured from the occipital protuberance, whereas in the suboccipitofrontal, it is measured from below the occipital protuberance. So next one, we also have the submentobregmatic. So the submentobregmatic is the diameter that can be measured from the point where the chin joins to the neck. The chin joins to the neck, going into the center of the bregma, which is the anterior fontanelle. So the area from where the chin is joined to the neck until the center, to the center of the bregma, is what we call the submentobregmatic. And this diameter is the presenting presenting diameter is the submentobregmatic when the fetus is in phase presentation, or when the fetal head is hyperextended in a point where the face is already the presenting part. So in this position, during the vaginal examination, we can assess that the submentobregmatic is the presenting part when we can palpate the facial features of the fetus. So we also have what we call the mentoventricle. So the mentoventricle is the diameter from the chin to the highest point of the vertex. So as we mentioned earlier, the vertex is the area from the posterior fontanelle to parietal bones and the anterior fontanelle. This is the vertex. Okay, so this is the vertex. So the landmark in measuring the mentoventricle is the portion or the highest point of the vertex going into the chin. So this is the mentoventricle. Okay, so this is the mentoventricle. So this is the presenting diameter when the fetus is in brow presentation, or the fetal head is is slightly extended. So it's slightly extended. The submental bregmatic, the fetal head is higher. The fetal, yes, is hyperextended, whereas in mentoventrical presentation, it's slightly extended. In vertex or in suboccipitobregmatic, the fetal head is well flexed. So next, we also have the submentoventricle. So the diameter from the point where the chin joins to the neck to the highest point of the vertex. Earlier, we also have other fetal diameter or skull, diameter of fetal skull that is measured from the point where the chin joins, which is the submentobragmatic. But this time, the area or the diameter that is being measured is from the joint, area or the point where the chin joins to the neck into the highest point of the vertex. So we have different longitudinal diameters. We have the suboccipitobregmatic, which is measured from the occipital protuberance going into the center of the bregma, which is the most ideal presenting diameter, because from this occipital protuberance going into this bregma, center of the bregma, measures around 9.5 centimeters. Next, we have also the occipitofrontal from the occipital protuberance going into the glabella. So this measures 11.5. We have the suboccipitofrontal, which is measured from below the occipital protuberance going into the center of the frontal suture. We have the submentobregmatic, which is measured from the point where the chin is joined to the neck going into the center of the bregma. So this is the presenting diameter in face presentation, wherein the fetal head is hyperextended. So this measures 9.5, which is similar to the suboccipitobregmatic, which is also 9.5. But the advantage in suboccipitobregmatic, the suboccipitobregmatic has the suture lines, which facilitates the molding that reduces the measurement of the suboccipitobregmatic, which is 9.5, and it will be further reduced when the fetal skull will mold or overlap with each other. So in face presentation, we do not have suture lines in the fetal face that will enable for molding. So we have also the mentoventricle, which is measured from the chin going to the highest point of the vertex. We also have the submentoventricle, rather. So by the way, the mentoventricle diameter measures around 13.5 centimeters, which is the largest longitudinal diameter of the fetal skull. So we have the submentoventricle, which measures around 11.5, and the landmark is from the chin going into the from the point where the chin is joined to the neck, going to the highest point of the vertex, which measures around 11.5. So as you can observe, with the different longitudinal diameters of the fetal skull, the smallest diameter is the suboccipitobregmatic, which is 9.5. So we have the presenting diameters of the fetal skull. So we have generally presenting diameters is divided into three. We have the vertex presentation, we have the brow presentation, and we have the face presentation. So in presenting diameters, we have two presenting diameters that is that enters the pelvis. So we have one transverse diameter and another longitudinal diameter. So in vertex presentation, as we mentioned earlier, the presenting part is the vertex, which is the area that is bounded by the posterior fontanelle, two parietal bones, and the anterior fontanelle. So when this area is the presenting part, the presenting diameter is the biparietal diameter, which is 9.5, and we have the occipito suboccipito-bregmatic, which is also 9.5. So 9.5 and 9.5, that is that resembles a circle. So another advantage in a vertex presentation, which is the ideal presenting diameter, is the presence of the suture line that is again facilitates molding, thereby reducing the diameter of the fetal skull. So we have the brow presentation. So in brow presentation, let me use this one. In brow presentation, the presenting diameter is from the chin going to the highest point of the vertex, which the position of the fetus is slightly extended. So slightly extended, making the brow as the presenting part, and the transverse diameter is the bitemporal. So if we will be using this one, the pelvic model, so in brow presentation, the position of the fetus is approximately like this. Okay, so the presenting diameter, longitudinal diameter, is the highest point of the vertex and the chin, whereas the transverse diameter is the temporal bone, okay, the bitemporal diameter. Whereas in vertex presentation, the position of the fetus is like this one, wherein the vertex is the presentation. So as you can observe, when the fetus is in vertex presentation, the diameter is smaller compared to the brow presentation. So the vertex presentation, or the fetus that is in vertex presentation, will be easier to deliver compared in brow presentation. The last presenting diameter is the face presentation. So the face presentation, the presenting diameter is the submental from the point where the chin joins to the neck and going into the center of the bregma, and the position of the fetus is approximately like this one. So during vaginal examination, what we can palpate is the facial parts of the fetus. Okay, so we also have other diameters of the fetal body, which can be a potential presenting diameter also. So we have the bisacromal diameter. Bisacromal diameter is the diameter of the biacromial, rather. Acromial is the diameter between the two acromion process or the shoulder blades. Okay, so in determining the presenting diameter of the fetal skull, approximately we can identify it by performing vaginal examination, by paying attention what we can palpate during the vaginal examination. So usually our landmark is the fontanelles. So our landmark is the fontanelle. So if we can palpate during vaginal examination, the lambda is approximately the fetus is in vertex presentation, whereas if we can palpate the anterior fontanelle, approximately the fetus is in brow presentation, because the anterior fontanelle is located near the face, and usually we palpate the diamond shape, whereas in face presentation we can palpate the facial features or facial parts. Okay, so that ends the discussion on the different diameters of the fetal skull.